Hello friends, we'll be seeing about daycare surgery today. So what is daycare surgery? It means that patient gets admitted in the morning, gets operated, following a brief period of observation which can range from 6 to 8 hours. He will be given some oral diet to check whether he is tolerating oral diet. We will also see whether the patient is able to comfortably pass urine or motion and then discharge them with certain advice which has to be followed in their home. Now, can all surgeries be done as a daycare surgery? No. Very few surgeries which do not prolong for more than 1 hour or 2 hours at the most, and those which do not require a long-term fasting, long-term nil per mouth, or one which cannot take oral diet for a longer time, so they are not eligible for daycare surgery. So few surgeries like uncomplicated gallbladder stone disease, uncomplicated hernias are the one which can be tried or routinely tried for daycare surgery. Not only the type of surgery, it also depends on the type of patient. If the patient is an elderly one with comorbidities like hypertension, diabetes and some heart diseases, definitely these patients will require a prolonged observation following surgery. So these patients also cannot be subjected to daycare surgery. Now, what are the advantages of daycare surgery? Patient can get back to their home in the same day. The hospital stay comes down. That gives a pleasant experience for the patient because he is in his own routine circumstances, so his recovery is very fast. At the same time, we give oral diet and oral medicines, so his bowel activities also starts very fast, and that helps in a faster recovery. Now, in the other terms, the financial expenses of the patient also comes down. At the same time, in terms of hospital, the bed's occupancy unnecessarily for a patient who can be eligible for a daycare surgery comes down, so that the bed can be utilized for another deserving patient. There are certain things which have to be followed during daycare surgery procedure. Everything has to be worked up before. Patient has to be given clear-cut instructions what all to be done before getting admitted, and exactly same thing should be reflected in the post-operative period also, like what diet should be taken, what drugs to be taken and at what time, and what are the symptoms with which one has to present back to an emergency or doctor if he or she develops during the post-operative period. So daycare procedure is actually a boon for patients and doctors, provided if it is selected for particular patient, particular group of surgeries, and at the same time one has to be educated exactly what has to be followed following the surgery also.